Are we facing another shortage of personal protective equipment in hospitals? Michael Einhorn is CEO of DealMed. Hello, Michael. How are you doing?
Good afternoon. How are you?
Great. Thank you very much for being with me today. What has been the trend in PPE sales over, say, the last 30 days?
Ever since the emergence of the Delta variant, PPE sales have increased quite significantly in many different product areas. It began probably in June. We're now in late August, and it's still continuing today.
Mm-hmm. Which products specifically in that under that category are in short supply right now, if indeed that is the case?
So PPE products in general are not in very tight supply. There are very significant issues in the supply chain presently, which are causing constraints, shortages across the board. PPE overall is somewhat stable, but there are indicators that there are going to be shortages. Some of those indicators include certain products running out of stock and alternatives being used to fill their place. A lot of supply issues coming out of many different countries, including China, and obviously the logistical challenges that all companies, not only healthcare and medical supply companies, face. And those are some red flags for an early indicator of a possible shortage that is yet to come.
So, to what extent do we still rely on offshore and foreign sources for PPE?
So, Robert, unfortunately, far too much. We rely on the majority of our PPE products from overseas suppliers. Sadly, I don't think the industry as a whole has really learned the lesson or has taken yet any action that they had to take. And so there's tremendous reliance on foreign countries and outsourcing. And there really hasn't been very significant change, specifically the change that we thought we would see at this point.
That's a shocking thing to say, considering that the experience was only a year ago. I mean, we hear about businesses failing to learn the lessons of something that happened a few years ago. This is still fresh in everyone's memory. In fact, it's not even a memory, it's a reality today. So my understanding is there were some companies and producers and manufacturers that stepped up temporarily to produce these supplies. Is that the case? And did they stop and go back to their old production lines, or what exactly has happened in the ensuing year that indicates that nothing has changed in a longer term?
Sure, there's several different factors. For one, you had the supply and demand curve, which was out of whack, and it's been out of whack since COVID. So for example, we had shortages. The shortages were followed by a glut, and then the glut was followed by layoffs. They stopped producing products, many factories did. And now suddenly you have increased demand, and demand has to catch up to supply. And so there's these mismatches in supply and demand fundamentally going back from March, February of 2020. So you have that, the specific issue, and there are others as well.
Do you consider, is it basically a product issue, or is there a supply chain issue too? Because as you know, many consumer products, many everyday consumer products are being affected by severe congestion in the supply chain, specifically at Southern California ports and in rail yards throughout the country. Does that slow down availability, or is that not so much an issue with PPE?
So those do slow down the availability of medical products. As I mentioned earlier, there are significant shortages in the healthcare supply chain and all sorts of different products, from IV type products to DME type products. There are all these shortages across the board, many of that resulting as a direct impact of these logistical challenges, like you mentioned, issues with California, issues with container ships, obviously increased costs, shortages of truck drivers. All this is creating the perfect storm for a potential issue down the road, which we're starting to see the early first steps of today.
Unfortunately, we've been hearing that perfect storm phrase too many times these last few years. Is anybody got a plan or to increase domestic production of PPE over the long term? Do you see any progress toward that objective?
So I've seen some what I'll call dog and pony shows where certain companies have made investments and have diversified a little bit. But on the grand scale, I haven't seen any massive grand scale as I would expect earlier on in the pandemic. Wow. I just don't see it, and there's specific reasons for it, which I can get to. But the reality is,
please do. I'd love to hear why.
I can. I think that people don't understand healthcare and how the healthcare supply chain works. First off, it works with a just-in-time supply chain model, which is dangerous, as we learned from COVID, very dangerous. There are discussions and all sorts of different ideas that people have put forth, but the reality is today it's just in time. So you have number one, a just-in-time model on healthcare, which is problematic in itself. And the second thing is the way hospitals and large IDNs, healthcare systems, et cetera, the way they buy their products. They buy their products off contracts referred to in the healthcare supply world as GPOs. The GPOs have contracts with grandfathered legacy companies that often buy from the same factories or produce it in the same factories, narrowed it down to a couple of few actual sources of where the product is produced. So in other words, there's no diversification. So a lot of the products are from a couple of big distributors who, again, buy from a couple of big manufacturers, all narrowing it down to the same source. And so getting into a healthcare system, getting into a hospital, trying to sell your product, even at a lesser price, even at a superior quality product, you're going to have a very difficult time because it's all contracted in. These contracts are long-term contracts, very difficult to get out of. Some of these contracts stipulate that hospitals have to buy 80% of their healthcare supply spend from specific manufacturers, from specific companies. And so there's not a lot of diversification. There's not a lot of opportunity for companies to come in. And when they do come in, it's just a short term to fill a certain gap, as we saw with PPE specifically, how many companies came in and started producing their own product and tried selling it into hospitals. Hospitals bought it, but then they went right back to the same old, same old. So you have that whole dynamic, which I think people don't understand is unique to healthcare. And that's something that's really driving complacency. And that's a problem.
Again, it's amazing that they would feel complacent given the current situation. So many manufacturers who had that same just-in-time model, such as automotive manufacturers and the like, are now said to be at least adjusting it somewhat, if not scrapping it, but certainly adjusting it to create some kind of a buffer stock or safety stock going forward. That's a realization that has dawned on them. But maybe you were saying the structure of the hospital care and medical supplies industry prevents them from going in that direction, creating new buffer stock and safety stock. Is there a possibility or what? So
that depends who you ask. The reality is, again, that when they're locked into contracts, long-term contracts, it's very difficult, A, to diversify, B, the model is still a just-in-time model, and C, what the argument to that is that, well, we're required to have stockpiles. For example, in the state of New York, we do a lot of our business. There are mandates to have stockpiles of product. Many hospitals have stockpiles of product, but it's really PPE product, a lot of the basics. And so it'll prevent them from running out of basic PPE products. But as an industry model, that's not replicated. And I'm not saying that should be replicated. I don't think the solution is to have a 90-day stockpile of everything. But I think you have to look at the supply chain as a whole, and stakeholders need to be aware that certain products you cannot run out of, and they need to come up with a plan on how to deal with that, and they need to come up with a plan how to diversify the supply chain, not just say it.
But since the federal government has gotten into the act with the Biden administration's so critical supply chain initiative and the task force that came out of that to address critical supply chains, I'm wondering if we need to move forward with some kind of a government-directed national reserve stock of this material for future use. Is that a possibility? Might we see that someday?
The government does have the Strategic National Stockpile, which failed during COVID. I know they're revamping that right now, and they're in talks of enhancing that. But you know, I'll bring up another point, and that is that hospitals, for the most part, and there are exceptions to what I'm going to say, but hospitals have no incentive, and I say that with caution, to buy superior or diversified products. The way the reimbursements are structured, the way payments are made, the way insurance companies pay them, Medicare, Medicaid, the reality is there's no incentive to diversify. There's no incentive to buy a superior product. So I can come in with a superior product. It can be a disposable, whatever, that's superior for whatever reason, proven superior. And I will not be able to sell it into the healthcare system, nor will the healthcare system be compelled. And I can't sell it into the healthcare system because of the contractual obligations they have, nor will they be compelled, even if they could, because there's no incentive for them, financially at least, to buy a superior product. Now, there are complicated ways that hospitals are paid for value, and healthcare providers, healthcare professionals are paid for that, you know, the outcome of patients. But in the end, it's not compelling enough. And that's kind of the problem. It's the root of the problem.
Not a very rosy picture. I mean, if it doesn't take a pandemic to make these companies see the light, I can't imagine what else it would take to see some reform. But I think what you're suggesting is we need broad, wide scale reform throughout the entire purchasing system in order to see some real progress toward the availability of PPE in times of distress and emergency. But anyway, Michael Einhorn of DealMed, thank you very much. You didn't paint a very positive picture, but you certainly painted a very realistic one and very informative. Thank you so much for your insights today. Really appreciate it.
Sure, my pleasure, Robert. Thank you.